I rise in opposition to this bill. This bill fundamentally changes who controls vaccine policy in New Jersey, and it does it so in a way that moves authority away from the public, moves it away from transparent national standards, and into a closed system inside the New Jersey Department of Health. And I didn't know a lot about this when this bill landed on our agenda. So in my research, I found the following. Right now, New Jersey relies on the Advisory Committee on Immunization Practices, or ACIP, which is a national body that operates in the open, publishes data, it debates in public, and it records its votes. Its guidance is consistent across all states, and it's subject to federal transparency and oversight. That matters because vaccine policy touches everybody, every employer in this state as well. But this bill removes that safeguard, and it takes ACIP out of our law and gives sole authority to the New Jersey Department of Health, which allows the Department of Health to set vaccine requirements on its own or in coordination with public health groups that New Jersey voters cannot see, we can't subpoena them, and we can't hold them accountable. That's not a small technical change. This bill is actually an incredible transfer of power. The Department of Health is already partnering with Northeast Public Health Collaborative, which is a multi-state coalition that works on vaccine policy and disease surveillance, but that organization is not subject to Oprah, not subject to New Jersey courts, doesn't answer to us as New Jersey legislators. Yet under this bill, the Department of Health could rely on those regional recommendations and enforce them as binding policy on our residents. This does not work. This was not thought through properly. That means decisions affecting our children, our workers, our families are made in rooms that the public's not allowed to enter. Maybe we aren't even allowed to enter as legislators. So this isn't hypothetical. We just saw what happened when public health authority operates without transparency. So on December 19th, 2025, just not quite a month ago, Public Health Council adopted major code changes under conditions that should concern every single person, regardless of party, in this chamber. Members of the public were locked out of a part of the meeting because of a bad access link. Materials were missing. Amendments were not properly circulated. Even council members complained that they didn't receive full documentation in advance. That same council would be given expanded power under this bill. If that's how public health rulemaking is handled now, why would we give them more unchecked authority? Doesn't make any sense. ACIP gives us a nationally consistent, evidence-based, transparent framework. Does not prevent New Jersey from protecting public health. It ensures that those decisions are made in the open and anchored to a process that can be examined. It can be questioned by us. I can't imagine, why would we write a law that would keep us out of the room? It's silly. This bill removes the anchor and replaces it with a system that is more insulated from scrutiny and more concentrated inside one agency. So parents are being asked to comply with mandates that affect their children. Our workers are being asked to comply with mandates that affect their livelihoods. The least we owe them is a process that's transparent, accountable, and grounded in standards they can see and are open to public records scrutiny. This bill moves us in the opposite direction. For that reason, many others, I can't support it. Thank you.